Sometimes we see people come in because they have used the Q-tip, our least favorite instrument of hygiene, and that can do several bad things. It can pack the wax in deep so that it cannot come out on its own, and they have to come in and let us clean them with something like this microscope. Sometimes it can actually cause damage to the ear. It can cause scratches in the ear canal that make people more susceptible to ear infections like swimmer's ear. And every year we see a few people who puncture their eardrums with Q-tips. So that's the thing we ask people mostly not to do. Obviously, what applies to Q-tips also applies to bobby pins, keys, and anything else that you might think about sticking in your ear. If you feel like you have a buildup of wax, or if you have a history of wax building up, there are some things that are available over the counter that are helpful. There are commercially made drops, such as Debrox, that can be used to remove wax, and that oftentimes works well. You probably are going to have to use them for several days if you have a lot of wax. You can also use hydrogen peroxide, either plain or mixed with water, and try to soak it out that way. In people who have a history of recurrent wax impaction, I oftentimes recommend that they use some peroxide once a week or so in their ears to try to remove a little bit of wax at a time and keep the wax soft.